Great. Well, thank you so much for having us here today. And we're really excited to have this opportunity to talk to you about medicinal cannabis, particularly for chronic fatigue syndrome and fibromyalgia. Yeah, my background, I work for the Cannabis Clinic in Auckland, as does Maxine, who's co-presenting with me today. And I have a background in anesthesia, as well as cannabis medicine. A second. I don't want to. There we go. So we've talked about that. So firstly, I just wanted to introduce you to the Cannabis Plant and give you a bit of background about that. So you can see the Cannabis Plant here, and in particular, the important part of the Cannabis Plant for medicinal cannabis, which is the female flower head, and in particular, the trichomes that exist on the female flower head. So this is having a look at the female flower head close up, and you can see that it's the unseeded female buds that contain the high amounts of cannabinoids at 16%. And this is the important part of the plant for medicinal cannabis. And just showing you those trichomes in a bit more detail. These are the tiny little crystals that cover the leaves and buds, and they're responsible for producing the cannabinoids, the terpenes, and the flavonoids, all which are meant to be thought to be effective for the medical use of medicinal cannabis. And the synthesis of cannabis begins in the trichomes as the flower blooms. And it depends on all these factors, the concentration of the trichomes, the amount of UV light, and other environmental factors. And important to note that there are more than 2,500 strains of these cannabis plants. Now, the medicinal cannabis scheme, I just wanted to quickly outline to you here. This came into effect on the 1st of April 2020, and the purpose was to improve access to quality medicinal cannabis products for patients. And medicinal cannabis products are only available to patients on a prescription from a doctor. And you can see here I'll show you in a moment, the medicinal cannabis products that have met the requirements. And so far, 17 products have met the scheme's minimum quality standard requirement. So they need to be written on a prescription from a doctor. And I'll go into that in a bit more detail here. And it's a regulation that unapproved medicines can't be advertised. So it's, yeah, we're not allowed to advertise a specific medicine, but you can see from this slide the products that have currently met the minimum quality standard under the medicinal cannabis scheme. And they include local products, imported products, CBD oils, combinations of CBD and THC in an oil form, and then also some flower products that have recently arrived on the market. And these have been recommended to be used as a tea, but they can also be used, some of them via a vaporizer. So that's the list of the products there. So as you can see, there's still a number of hoops to jump through to get medicinal cannabis, but hopefully things are getting easier by the day, and we're getting it out to the people that really need it. So you'll see medicinal cannabis dispensaries start to pop up, and there are already a lot of changes in that regard that have happened in the last year or two. So the conditions that may respond to cannabis medicine are multiple, and the kind of common theme is that it's often the inflammatory conditions. So we see a lot of people, obviously, with chronic pain, insomnia, and anxiety, but we're starting to see really good results in these inflammatory conditions, including autoimmune conditions, and even neurological conditions, as well as all the ones listed here. And as you can see, it works on every organ system in the body. So, it's got extremely widespread effects. And this all comes down to the way that it acts. And its action is via the endocannabinoid system. And this is basically an evolutionary preserved signaling system that exists in all vertebrates. And it has important regulatory functions throughout the body. Dysregulation of this system is what causes pain, inflammation, neurodegenerative, and psychiatric disorders. And the important components of the endocannabinoid system are the cannabinoid receptors CB1 and 2, and the endocannabinoids that interact with these receptors. And the main ones here are anandamide and 2-AG. So the easiest way to think of the endocannabinoid system is as a master regulator. So its goal is to maintain homeostasis. And so it's involved in all of these important physiological processes in the body. And it's the master regulator of this homeostatic mechanism. And you can see the location in this diagram of the CB1 receptors, mainly in the brain and central nervous system. They're the red dots here. And then the CB2 receptors, which are the orange dots, located mainly in the immune system. So these are the principal receptors that the medicinal cannabis will act on. And importantly and interestingly to note, the endocannabinoid system wasn't discovered till the 1990s. So it's relatively recently discovered, and it certainly wasn't taught when I was at medical school. And speaking to some younger colleagues that only finished a couple of years ago, they said there was no teaching on it either. So it's a relatively recently discovered system, and it's still poorly taught in medical schools. So that explains why a lot of doctors don't really know much about it, or don't appreciate how important it is for maintaining homeostasis in the body. And you can see here all the body's endocannabinoid system. So the endocannabinoid receptors throughout all the organ systems of the body. And currently, people who don't support the use of medicinal cannabis say, but the evidence is not satisfactory. And whilst it's true that there are very few good quality placebo-controlled double-blind trials, we get a lot of anecdotally good evidence, and as well as case reports and small-scale studies. So there is evidence out there, and the reason that there aren't the large quality control plus double-blind trials is because of the legality of cannabis. For the last 80 years, it's been illegal, so those studies haven't been able to be done. But hopefully, it's starting to change now, and those studies will be coming out. So I just wanted to show you in a bit more detail what CBD and THC, they're the two main components of medicinal cannabis, what they are and how they work. So basically CBD, first of all, it has indirect effects on CB1 and CB2, as well as affecting serotonin receptor, it is an anti-anxiety, anti-epileptic, analgesic, has mood improving effects, and you can see the list here. So we use it a lot for anxiety, and there's been some evidence from a large case series for Colorado finding that it reduced anxiety scores significantly. And the good news is there's no risk of tolerance or rebound with CBD. The strongest evidence for CBD's efficacy is in epilepsy. And it's very safe. It doesn't cause any impairing effects, even at very high doses. We use it for children with autism. It's safe to use. And we've had a lot of success there. Now, moving on to THC, it's the main psychoactive component of medicinal cannabis. It has variable effects depending on the individual, the dose, and levels of other cannabinoids. Now, it is the, as mentioned, the psychoactive component, so it can alter thinking. It can cause a sense of euphoria or wellness. In some people, it can cause heightened anxiety. So it's just always something to be aware of. We tend to always prescribe it with CBD on board so that we don't run into negative side effects from it. So in real life, what are the risks of a trial of medicinal cannabis? Cannabis is very safe. It's unlikely to cause any psychosis in a patient under 30 with, over the age of 30 with no family or personal history. So the concerns about psychosis were basically from a study showing an association with schizophrenia or psychosis in young people who used very, very heavy doses of very high concentrations of THC. But cannabis, medicinal cannabis, won't cause psychosis. It could unmask psychosis in somebody that's prone to it if they were taking a high dose. So we exercise caution in anyone that's got a family history or personal history of psychosis. And importantly to note, CBD has protective effects for psychosis. So that's why, as I mentioned before, we prescribe the two together generally. Possible adverse effects of THC can include the following. The common ones being drowsiness. Some people can have a dry mouth. Some people can have heightened anxiety. Of course, if you're smoking it, the risk of cough. So we don't recommend smoking. We recommend if people are using flower to use the tea or the vaporizer. And then some people can report blurred vision. Rarely we see problematic things such as tachycardia, that means fast heart rate, cannabis hyperemesis, which is a rare condition whereby someone gets intractable vomiting that they often present to emergency department for because it's quite severe, and the only thing that relieves it is going under a hot shower. But that is one of the very rare side effects. I haven't seen anyone with that myself, although I have heard from colleagues that have worked in the emergency department that they have seen it from time to time. But again, it's people that are using street cannabis that's bred for high THC content, not from medicinal cannabis. And if a patient does experience an adverse effect, we tend to just reduce the THC, increase the amount of CBD, and consider whether they just need to be on CBD alone. If they're having an adverse effect, it's almost always from the THC itself. So we've got ways to reduce those side effects. Now, some people are interested in the cannabis drug interactions because they're on other medications for their chronic illnesses. And the good news is that cannabis really interacts in a clinically significant way with any medications that people are taking. The one to note is warfarin. It can, it basically can decrease metabolism of warfarin via inhibition of this enzyme here. So in warfarin, we have to have increased monitoring of the INR. But on the whole, there's very few significant drug interactions, and it's very safe to take with most medications. And the whole goal of our treatment plan is to work out the optimal dose for the patient. So obviously we want the highest benefit with the lowest amount of side effects. So that's why we titrate the doses. We start on a low dose and we slowly titrate it to effect, because everybody's quite different in how much they need. And we get a individualized dose response. Now, just as I mentioned before, there are a few considerations when we prescribe medicinal cannabis. The only real absolute contraindications are psychosis or pregnancy and breastfeeding, and then severe unstable cardiopulmonary disease. And this is like a recent heart attack or unstable angina, something like that. And then obviously if somebody's allergic to any cannabinoid or product used in the manufacture. And then, as I mentioned, we do exercise caution in the under 25s, those with liver or renal impairment, people with drug dependency issues. However, cannabis has been useful medicinally to reduce people's opioid dependence, and has been useful in that regard. So that's something to consider. And then the pediatric and elderly patients, we go very cautiously with the dosing. And as I mentioned, there is that concern in the under 25s who have had heavy regular cannabis use of high doses of THC. Now, the safety profile of medicinal cannabis, just to give you an idea, there's been no deaths substantiated in humans. They gave monkeys more than 9,000 milligrams per kilo orally, no deaths. It is potentially possible to trigger something like a myocardial infarction if somebody had very unstable angina and was unable to tolerate hypotension or tachycardia, but that's why we exercise caution in people with unstable cardiopulmonary disease. So it's very safe. And you can see here from this diagram, this is the ratio of a fatal dose to an effective dose, and you've got heroin up the top here, so you only need to give 5 times the dose to get a fatal dose, 5 times the effective dose. And then alcohol, which is probably a good benchmark because people so commonly used, you really only need to give 10 times the effective dose to have a lethal dose. Then going down the list, you've got things like psilocybin, LSD, and cannabis is right at the bottom. You've got to give more than 1,000 times. Well, there were no fatalities, so 1,000 times the typical effective dose was given, and still no fatalities. So it's actually way off the chart here. So there's people have concerns about the safety of cannabis, but really, when you look at that and you exercise the precautions that we take, it's a very safe medicine to use. Now, some people are also interested in the driving rules, and you'll be happy to note that the test in New Zealand is impairment. So basically, if you are a medicinal cannabis patient and you've got a prescription for it, it's legal to drive, although we tell patients not to drive for 8 hours after taking it. And as long as they don't feel impaired, it's legal to drive. So studies have also shown that legalization of medicinal cannabis in America was associated with a reduction in motor vehicle crash fatalities. There's little evidence, if any, to indicate that drivers who have used cannabis alone are more likely to cause serious accidents than a drug-free driver. Obviously, if people are using other sedative medications with it or other pain medications, then that's a consideration to take as well. So, yeah, just to kind of end up here before Maxine gets into talking about chronic fatigue syndrome specifically. I hope I've just assured you that cannabis is a safe medicine when used appropriately. It has all the advantages medicinally to not causing the risks of smoking and alcohol, and is very safe with no deaths from it. So I'm going to end there and pass over to Maxine, who is going to talk specifically about chronic fatigue syndrome and the application of medicinal cannabis for that. Thank you, Maxine.
Hello, everyone. It's great. I'll
just stop sharing, Maxine, so you've got the...
Yeah, thanks. Thanks, everyone, for coming. I'm just going to pop this up and see if we can do this. How's that looking? All right. Alrighty. Yeah, so I'm Maxine. I'm a registered nurse. I graduated in 2016, and I was a primary care nurse in a general practice for quite some time before moving to the Cannabis Clinic. I have a lot of personal experience with chronic fatigue myself. I developed chronic fatigue when I got glandular fever when I was 18 years old. It was fairly mild for quite some time, up until about 4 years ago, when I developed POTS, which I'm sure some of you will be aware of, which is a condition that encompasses a fair few things, but primarily a fast heart rate when standing up, and it's pretty debilitating and often associated with chronic fatigue. And at that point, my chronic fatigue got much worse. I had to change my job because I just couldn't function. A lot of the time, I still do my job from bed, which I'm very privileged to be able to do. I started CBD last year, and it made a huge difference. I became much more functional, always felt like I went into somewhat of a full remission. But unfortunately, I got COVID at the beginning of this year, and that set me back quite a bit. So let's dive in. Chronic fatigue syndrome, what is that? What symptoms do people generally experience? So these are the 5 kind of main issues that are faced with people that have chronic fatigue syndrome, and I'm sure you're all very familiar with this, but I'll run through it quickly. So severe fatigue is one of the main ones, of course. It's often worsened by activity, and it's generally not relieved by rest, and it's very closely tied to post-exertional malaise, in which you can experience fatigue that is disproportional to the activity that you're carrying out, and require a lot more recovery time than otherwise would be needed. Another one is sleep problems. So a lot of people with chronic fatigue tend to have sleep problems, and that can be trouble sleeping, but also feeling exhausted on waking, and also feeling flu-like kind of symptoms. Cognitive dysfunction is another one, and it's often referred to as brain fog, and that can involve difficulties with communicating, slowed responsiveness, memory issues, and the like. And then the next one is autonomic dysfunction. So that's what I mentioned before that I struggle with, is POTS. So that comes under autonomic dysfunction, and that is the dysfunction of your automatic nervous system. So that involves things like your heart rate, that sort of thing. And so the symptoms of it can be dizziness, high heart rate, fainting, nausea, and all of these symptoms can be particularly worsened when going from a lying down or sitting to standing position. I think one of the main things to mention, and is probably something that all of you probably had an experience with at some point or another, is that it is not a psychological disorder, and it is a biological condition, although can be very commonly associated with psychological disorders just because of the impact that it has. Yeah, so what are the causes of chronic fatigue? So there's a lot of potential causes, and it's still not fully understood. It's quite a complicated disease. There does seem to be a level of genetic predisposition. It can be triggered by viral illnesses like glandular fever. There does seem to also be, more relevantly, a level of chronic fatigue syndrome that can be experienced after COVID. It can involve immune system changes, or often does involve immune system changes, and that can include autoimmunity, so our own immune system attacking our body. Earlier, Rose mentioned that 75% of people with chronic fatigue syndrome do seem to have it triggered by a viral illness. So the commonly associated conditions with chronic fatigue, one of them is fibromyalgia, and I'll touch on that a bit more in depth in a second. As I mentioned before, flu-like symptoms, chronic pain, anxiety and depression, gastrointestinal issues like IBS, medication sensitivities, also temperature hypersensitivity, general sensory sensitivities as well. Fibromyalgia in particular is characterized by widespread pain and tenderness or sensitivity to touch. And there's a lot of crossover of the other symptoms that can be involved with chronic fatigue as well. So you've got fatigue, sleep, memory, and mood issues. So yeah, that's those in a nutshell. In terms of fibromyalgia, the causes are not very well understood still, but there does seem to be a lot of involvement of the nervous system, and in particular the central nervous system. So where does medicinal cannabis come in? Medicinal cannabis is a huge agent of, it helps with inflammation. So it helps to reduce inflammation, but also, as Anne mentioned, the endocannabinoid system is a huge regulator of multiple bodily systems. And as you can see, these conditions affect a whole bunch of our bodily systems. So that's why it can have such a broad range of effect. There's a particular study that was done by the National Academies of Science, Engineering and Medicine. And this was a comprehensive study collating and reviewing the research findings dating back to 1999 related to the health effects of recreational and medicinal use of cannabis. And so they presented this report, and basically it describes the strength of evidence that exists for different conditions. So they found substantial evidence for chronic pain. They found moderate evidence for sleep disturbances related to pain and fibromyalgia. They found limited evidence for anxiety and insufficient evidence for depression. That being said, I can say that anecdotally, there does seem to be quite a significant amount of people that do seem to get a lot of good effect for anxiety and depression. Certainly a lot of people that I've spoken to as a cannabis nurse. So that's my experience of it, and myself personally have benefited as well. But of course, everyone does respond differently, and it's not a fix-all, it's not a cure-all, but it can be a really important piece of the puzzle. So pain relief, how does it work? So the endocannabinoid system regulates pain and the experience of pain. There are cannabinoid receptors in immune and nerve cells, and it has immense anti-inflammatory effects. Fibromyalgia studies that have examined the relationship between cannabis use and symptom relief found that patients who use cannabis experienced a significant reduction in pain and stiffness. There's an Israeli study done in 2019 of a cohort of patients with fibromyalgia, 239 if I'm correct, and they found that pain intensity measured on a scale of 0 to 10 dropped from a pre-cannabis use median score of 9 out of 10 to a 6-month median score of a 5 out of 10. with 81.1% of the participants experiencing positive treatment results. So that's quite significant. So in the same way that medicinal cannabis reduces inflammation, that is, in part because of its effect on the immune system. It has quite a significant effect on regulating the immune system and reducing the overactivation of the immune system that can often be involved with both of these conditions. THC in particular seems to be able to reduce the amount of inflammatory immune cells, but also, interestingly, it can increase the amount of anti-inflammatory immune cells. So it has two kind of opposite effects there. CBD as well it can be quite effective as an anti-inflammatory agent. So part of the reason we want to reduce inflammation is to reduce pain, but there are other effects that inflammation can have on the body, and one of these effects is impairing mitochondria. So mitochondria is the powerhouse of your cell. They have a crucial role in energy production. And when inflammation impairs mitochondria, we have less energy and we become fatigued. So when we reduce inflammation, that will allow for the mitochondria to function more normally and ideally give us more energy. And there does seem to be as well a level of pain that can result from this lack of energy from the impaired mitochondria, because our muscles are lacking in the energy required to work properly, and so that can result in pain. So another really important part of recovery is sleep. Sleep is immensely important for a variety of functions, for learning, memory consolidation, energy levels, and the endocannabinoid system is a huge regulator here as well. THC in particular can have quite a potent sedating effect, and so that is often prescribed for sleep to be taken at night. CBD is an interesting one. The effects of it are slightly less understood, and it seems that it can have two almost opposing effects. So when taken in lower doses, CBD seems to have quite an alerting and energizing effect. This does differ between people, so this is a generalization. But generally, that means that CBD can be quite good to be taken during the day when you might be needing more energy. And then at higher doses, it seems to have the potential to have a more sedating effect. So that can be really good. And it can also help to increase the length and quality of sleep, and has been shown to do so. Something else to mention is terpenes. So terpenes are compounds found in the cannabis plant and in other plants as well. And they can have therapeutic properties of their own. And there are some terpenes that have specifically sedating properties. So when we're prescribing products for you, if we're prescribing flower, we can specifically choose flower products that have terpenes that promote sleep in order to help with that. So mental health is another huge one. Chronic fatigue, fibromyalgia, it all has a huge impact on quality of life. I'm sure you're all well aware, and that can be incredibly depressing and anxiety-inducing. So in terms of mental health, previously I mentioned that the NASEM study found limited to insufficient evidence for medicinal cannabis helping mental health. In contrast, the Israeli study that I mentioned previously, done in 2019, on patients with fibromyalgia, found that 80.8% of patients who suffered from depression showed improvement in the depression-related symptoms. And the quality of life scores went from a pre-treatment rate of 2.7% of participants reporting good or very good, up to 61.9% reporting their quality of life to be good or very good. So that's quite a significant increase. The other thing to mention in regards to mental health is that CBD in particular can help to calm the nervous system. And this in turn helps to calm the adrenaline response. And that's often associated with anxiety and stress. And these anxiety and stress can result in increased inflammation because of the physiological processes that occur. And so when we reduce stress and anxiety with CBD, that in turn can also help to reduce inflammation further. Something to note that is quite interesting is this theory of cannabinoid deficiency. So there's a theory that across these conditions, because they have such similar overlapping symptoms, there could be a level at which people are deficient in cannabinoids. And a quote from a study on metabolic features of chronic fatigue syndrome from 2016 stated that if endocannabinoid function were decreased, it follows that a lowered pain threshold would be operative, along with derangements of digestion, mood, and sleep. The same study also found that a particular endocannabinoid, so that's a cannabinoid that we produce naturally, was deficient in female patients with chronic fatigue. So in turn, when we take medicinal cannabis, we can account for this deficiency and hopefully rebalance our system. Another important point to mention with medicinal cannabis and these conditions is that it seems to have quite a high potential for sustained effectiveness. And this is something that is really important with chronic illness, because as I'm sure a lot of you will have experienced, some medications will work really well initially and then just stop working after a while, and a tolerance can build. So the reason that medicinal cannabis does seem to have a level of sustained effectiveness is because for a few different reasons. So one of them is that there are multiple strains. And so you can change the strains that you're taking to reduce the likelihood of your body building a tolerance to each particular strain. There are also many different routes that you can take the medicinal cannabis. So you can take it orally, you can inhale it, and you can apply it as a cream. And so all of these different ways of doing it can also help to reduce the building of tolerance. Something that I thought was a little bit funny is that according to one study that I read, CBD, because it affects so many bodily systems, it is called the promiscuous model. The promiscuous molecule. And yeah, so the general idea is because it works on so many bodily systems, it slowly nudges the body out of a state of illness into a state of health. There is still a level of tolerance that can be built with medicinal cannabis, in particular with THC. That can be fairly easily addressed though, if it's managed well. So generally, if tolerance is building, we recommend taking at least a 48-hour break from the THC, and that can be quite helpful to reset tolerance. And as I said before, trying different delivery methods and different strains can help with that as well. There doesn't seem to be as much of an issue with building tolerance with CBD, although it does seem that it can happen in some cases. Interestingly enough, one of the solutions to CBD tolerance is to just take less of it, and that can actually have more effect. So I wanted to leave you with this quote, and I hope it instills a level of hope. The true gift of this treatment is in its ability to transform the body back to normal states in a slow, methodical way. This slow nudging back to normal is the best way to move from a state of disease to that of wellness, because it allows the body to slowly adapt to establish a new and lasting balance point of health and pleasure. That's it.
Thank you so much for that walkthrough of the science and how you the effects it can have for us. Shall I open up for questions?
Yes, sounds good. Yeah.
Actually, I've got one. So if someone comes to see you, what sort of what are the number of appointments and frequency of appointments that you would normally that a person would normally be committing to?
Shall I go first, Maxine?
Yeah, sure.
Okay, so we normally see someone if they're starting CBD for a 6-week follow-up. If it's THC, we start with a 2-week follow-up because there's more chance of side effects from THC in that first 2-week period. Yeah, so those are the 2 follow-up times, and then once we get someone on there, we've titrated them to the correct dose, and they're stable on that dose, then we tend to see them every 2 months to write another prescription and for a follow-up at that point. Do you want to add to that, Maxine? Because yeah, sometimes Maxine will see people, if they have issues in between those times, they'll get in touch and see Maxine often as well.
Yeah, so we have the more structured formal follow-ups like Anne mentioned, but yeah, us nurses provide consistent support through email and phone calls, and so you know, there is a lot of scope for just kind of contacting us if you're having issues, just to kind of have a quick question here or there, where we can support people. But yeah, and pretty much covered the frequency of formal follow-ups.
And Brittany's got a question.
Yeah, hi. I was just wondering what sort of like communication do you have to have with our GPs? Like if we're already seeing our GP for medications and we were to pursue cannabis for some of our problems, would we need to consult our GPs as well? Or like, do you have problems with GPs not being on board?
Yeah, I can speak to that. Yeah, so we give patients the option. So there's a form that we get you to tick whether you consent for the information to be shared with your GP, because, you know, understandably we have had some people that feel their GP's not on board, so they'd really rather not. They might have broached it with their GP and just not received a very you know, welcoming response, so they don't feel comfortable, and so we leave that up to the patient to choose. Yeah, so that's pretty much how it works. So we're very, very happy to share the information with the GP as long as we've got your consent to do so, but understandably not everybody feels they want that, so we keep it open.
And do you recommend, if we are interested, to talk to our GP first and then come to you, or?
Yeah, we do recommend that because it's really nice if they are on board to have that relationship. We can email them back, let them know what's going on. But again, it's up to you to gauge the receptivity. As I say, not all GPs, people say, oh, I don't think my GP would be on board, so they didn't want to raise it. So we don't require a GP referral, but we always encourage people, if they feel open to it, to discuss it with their GP. Yes.
Thank you.
You're welcome.
There's some questions coming in by message here. John asked, is there any particular blend of CBD or THC and THC that's best for ME? It's a tricky one to answer. everyone responds so differently that I would say it's very much a matter of starting at a low dose of both, and it's often a lot of trial and error to figure out where your sweet spot is. Everyone just responds so differently to different doses. Do you agree, Anne? I mean, would you add anything there?
Yeah, 100%. Yeah. We would probably tend to start someone on CBD on its own, and but gauging on whether there's quite a degree of insomnia involved, then adding THC at night is really helpful for those people. But yes, it's very individual to what dose of each and what ratio you'll need even. So yeah, trial and error is really the only way. But we tend to get a feel pretty quickly, and patients get a feeling for their own what they need quite quickly. So it's not too difficult to usually figure it out between the two of us and get a good result. Yeah,
and I think that's the beauty of it as well, is that there is a lot of flexibility in terms of making it work for you and individualizing it. So you have quite a lot of autonomy in terms of changing the dose. We give you guidelines within that, but I think that's kind of the beauty of it, as opposed to medications that you kind of just get prescribed a standard dose and you kind of just have to hope that it works for you.
100%, yeah. So Anne has her hand raised. Do you want to unmute, Anne?
Hello, hi. I'm just wondering, I had CBD isolate prescribed, and I did try really hard to get to work with it, but I kept finding that I was hyper alert, and being fatigued and hyper alert at the same time is an awful place to be, and gave up in the end. My question is, I'm a micro responder to many medications, and so with CBD oil, I know the comment was made that you take more if you want to be sedated and less if you want to be more alert. How would you help somebody who's a micro responder work that out? Because my fear would be that if I took more, that it might exacerbate something, like, because so many drugs and even some supplements do that. I have to go down rather than up. So just wondering, because I know there are a few of us that are micro responders. Yeah.
Do you want to go, Anne, or shall I? Yeah, I'm happy to.
Yeah.
Yeah, I mean, I think the thing that's important to be aware of with CBD is that it is very, individual dependent. So those kind of statements in terms of lower doses being alerting, higher doses being sedating, they're fairly generalized, broad statements. And I think, if it was me, I would probably suggest going even lower. If you're someone that is very sensitive to medications, I probably wouldn't suggest just trying a higher dose, because like you said, that may be a very unpleasant experience. So yeah, I would probably suggest having a very, very low dose, seeing how you go on that, and potentially balancing it out with a very small amount of THC as well, to reduce those alerting effects that the CBD is having.
More questions, Rachel, in the I took CBD oil for 3 months, but sadly found my mood was more changeable while I was taking it. Have you come across this before? And if so, any suggestions for how to reduce the moodiness? I'd really like to take CBD, but not sure how to get around this side effect.
You want to speak to that, Maxine?
Yeah, cannabis. Certainly have come across some people having these kind of responses where changes in mood kind of go the other way in terms of what you're looking for. In terms of how to address it, again, it would probably be a matter of potentially lowering the dose and going more slowly with it. Otherwise, it would be a matter of trialing different ways of taking it. Like having it, again, like I said with Anne, having it as a tea, a flower tea. Honestly, it really is a lot of trial and error. Anne, do you have any other suggestions?
No, not really. It's not something we commonly see. People mainly say it improves their mood. So yeah, I would just look at which, it really does depend also which brand, which strain you're using. Check whether it's an isolate or a full spectrum. Change brands, try a different brand. And then, yes, possibly trying the high CBD flower instead. I would do all of those things because, yeah, it's not common that we see people have a worse mood with CBD. It's usually the other way around. So, yeah, I would just try a different one, to be honest with you. Yeah.
Thank you for answering that. And then Lauren's asked about tea. Would it have a distinctive cannabis taste and smell? Or not so much with low doses?
Yes, it does, because it's the actual, so it comes as the actual flower bud in a pot, basically, so in a jar. So it's the smell of cannabis. When you make it into a tea, you add some kind of coconut oil or some fat as a binder, so it doesn't give off an aroma like smoking cannabis would at all. So you could be sipping it at wherever you are and not feel like you're giving off this massive smell to the whole house. It won't be that conspicuous, if that's your concern. Anything to add there?
I would just say, in terms of taste, I think there is quite a plant-like taste to it, and some people like to add things to it to kind of make it a bit more palatable. So you could put honey in it, you could just put anything in it really that makes it taste a bit better.
I think often our people are very sensitive to smells, so I wonder if that was maybe where the question has come from, but as well as but I guess we're saying try it and see, aren't we? Verena asked, is there a subsidised option?
Good question. So if you get in touch with our clinic, we can let you know about that. We have had, so there's a couple of options there. We've had some success with people using WINS for paying for their medicine, and I've just got something through from Rua, which is one of the New Zealand medicinal cannabis companies located in Gisborne, and they are offering compassionate access to Rua CBD. So we have all of that information at our clinic, and you can inquire about that as well. So so there are some options. So if cost is the only limiting factor, please don't be afraid of getting in touch, because actually this is the best time right now that we've dropped all the prices by 20%. They're the lowest they've ever been. So this is actually a really good time to be considering it as an option. And if cost is the only thing stopping you, please just check again, because those costs have come down massively. Anything to add there, Maxine?
I think you pretty much covered it. Did you mention we do offer payment plans as well?
Good point. Yep. So there's payment plans. Yep. So please don't let cost be the only barrier. Please come and discuss with us. We can help you find a way to make it work.
And I think you can also often, to some extent or another, adjust your product and your dosing to suit your budget to some extent.
Yeah, 100%. Yeah.
Miriam's asked about the cream for fibromyalgia and arthritis. How does one get this, please? As I know the cream works for my pain.
Okay, so yeah, the cream is really helpful. So it's on our dispensary. So to get access to the dispensary, you just have to have a consult with one of the nurses or doctors in the clinic, and then you'll get access to the dispensary where you basically get your own personal link, and that gives you access to all the products on there, and you can order the cream from that page.
Yeah, so the cream does have to be prescribed by a doctor through a doctor's consult.
Awesome, thanks. John's asked, any experiences of taking low dose naltrexone and medical cannabis? Some folk say there is synergy.
That's a very interesting question. I've heard that as well. I haven't specifically had a patient or case that I can comment on, but I have heard that. So yeah, I don't personally have any expertise there that I can talk to, but very, very interesting observation. How about you, Maxine? Have you seen that at all?
Yeah, I mean, there's certainly people that I've had follow-ups with who are taking both and seem to find it helpful, but it would be hard for me to say how much more helpful they're finding taking both than they would be just taking one or the other. But there does seem to be some potential benefit to be had there.
So perhaps we need some people trialing it and doing it as a case study. Yeah.
That would be helpful.
John's also asked about typical costs. Can you say such a thing?
Yeah, so it really depends on the dose that you need. Yeah, so it is actually really hard to comment on that specifically. I mean, we say $2 to $6 a day for CBD in most cases. Some people with chronic fatigue, though, would require a higher dose than the average CBD user. So it could get to a bit more than that. But I think you're going to see some benefit at those lower dose, the kind of commonly prescribed doses. The high dose, you may get additional benefit, but I'm sure that you'd get some benefit from the commonly prescribed dose, which is about between $2 to $6 a day. Have you got anything to add, Maxine, on that?
Yeah, I mean, I think so generally in terms of CBD as an upfront cost, you'll be looking between $100 to $300. For THC as an upfront cost, you're probably looking around $200. But like Anne said, it's difficult to say how long that will last you. Because doses vary so significantly. So the daily cost is an easier way to break that down. In terms of, shall I go through consultation costs? Would that be helpful?
Yeah, that would be helpful. Yeah.
Yep. So in terms of consultation costs, for initial consults, you're looking at $99. If you have a prescription from your GP and you send that in to us, your initial consult would be $59. And then follow-ups are, you can either have a follow-up with a nurse for $35 or a follow-up with a doctor for $79. And we have some required follow-ups. When you're on THC, the required follow-ups are every 3 months, and that is a legal requirement, which can be done with a nurse. And if you're on CBD, we need to have a follow-up at least every 6 months.
That's good. Thank you for explaining that.
Nice.
Brittany's asked, is the Cannabis Clinic the only source for medical cannabis prescription? I think you can Google that, yeah.
What's that?
Well, I guess we can Google that.
Yeah, so yes, so to answer that, you know, GPs themselves are allowed to prescribe medicinal cannabis, but the issue is many of them are not comfortable doing so. They just don't have the knowledge and expertise and experience. So that's why we set up to be a specialized clinic that can offer all of that. Yeah, so that's why we exist. Yeah. There are a couple of others, but we believe that we offer the best service and the best prices. So, but yeah, as you say, you can see on, you can see for yourselves there. But yeah, we pride ourselves on offering the best service and prices.
Awesome, thanks for that. And Peter's asked whether my ability to pronounce words today has gone. Amitriptyline, many of us with MECFS use this to help with sleep, and CBD are usually, is CBD compatible with that?
Yeah, so CBD on its own is not the best thing for sleep. What we would do is be giving you a combination of THC and CBD for sleep, and that would be comparable to you know, the effect of amitriptyline for sleep. Amitriptyline is one of those medications you can't just suddenly come off it. So if you were to come to us, we would give you a slow reducing regime for your amitriptyline and give you a combination of THC and CBD to take at nighttime instead. So we would wean you off slowly off the amitriptyline. Yeah.
Thanks for that. And I've just realised we've gone over time. So, are there any final comments you would like to make, Anne or Maxine?
No,
just
I
thank
mean,
you for having us. Yeah.
Yeah, thank you for having us. It's been such a pleasure to be here, and yeah, such a pleasure to meet your group. And yeah, if we can offer any support, we would be very, very happy to do so. Yeah, so thank you so much for the opportunity.
Oh, well, sorry.
Oh, I was just going to say, the other thing that you can do, if anyone wants to have one-on-one chats, you can book a free nurse phone call with us, and we can answer any questions you might have more individual to your situation as well.
Oh, that's great to know. Yeah. Well, we're really appreciative of you preparing for the session with us today and sharing what you know about medical cannabis and your experience with it. And yeah, you've answered a lot of questions in your presentation and also following, and it's been really helpful to us. So thank you very much for joining.
Oh, it's a pleasure.
Oh, you're welcome. Thank you so much for having us.
Okay. Thank you.
Thank you. Thanks,
Bye-bye.
everyone.
Bye.
Thanks, everyone.
Bye.